Students today have many more roles than certainly I did when I was a student. My role was to be a good student, but now students are working, they've got lots of other responsibilities. It's difficult, but prioritisation and time management skills are absolutely crucial.
Being passionate and committed to the things that I take on and planning ahead means that I get to enjoy the things I do and see them as a way to be challenged and be better and grow.
I find integrating pretty stressful.
I was one of those who got into the med school of my choice on the waiting list. And here I was surrounded by all the people who made the first cut.
Hi guys!
So as an Indigenous medical student, I know that I left my family and my country to be down here. And that was a real big struggle for me because as an Aboriginal woman, I take my strength from my community and my family.
As an international student, I have to pay $52,000 a year. That gives me extra pressure of having to pass all my exams, because if I fail, that means I have to pay extra money for the semester. Plus, even if I pass all my exams, I don't get a guaranteed job.
People need to remember that medicine is a kind of a big mixing pot. You've got people from rural, people from the city, you've got Indigenous people, you've got international students, and that sometimes makes it a bit hard to kind of have an inclusive group. The students that I see, they don't fit in any of the little groups. And that's often the students who are the most stressed and lonely. Good practice of being a doctor is reach out and ask them, how are you? Or would you like to have a cup of coffee? And sometimes you may be surprised how interesting they are once you get to talk to them. It's not uncommon that people have mental health issues, and it's a good thing to ask for help. The earlier you get onto it, the faster people can help you. That's why we have people like me in medicine, someone friendly who you can go to and speak to and start working through your issues. Those people who work through their mental health issues would be much better healers and much better doctors at the other end. Because what they're learning in that process is actually to deal with adversity successfully and to understand their patients and to have real empathy with what they're going through, because they know what it feels like.
Obviously you can enjoy your studies and what they bring you, but you need to have other things that bring you joy. Your family, your friends, hobbies, sports. I particularly like sport, and my son is now learning various sports and I help him with that, and that helps to de-stress me as well.
And although it's true that most of the time you have is spent being a doctor, there is always some time that you can squeeze in to pursue a solitary interest, an interest that you can do by yourself that allows you to think, to reflect, whether it's painting, music, writing as I do.
I find talking to people in the years above me is really helpful, because even just for them to say you'll get through it or it's all going to be okay definitely helps.
I find the best way to de-stress is a good hug.
Eating well, exercising, finding some time for yourself, finding some time for other people in your life, and having some good supports within the medical community are sort of all elements of functioning well in medicine.
The degree takes 6 years for a reason, and we're learning how to be doctors, but also you're spending 6 years learning skills for adulting, and I think bearing that in mind, we're all going pretty damn well.
Remember what it was that brought you here and what it is that keeps you here, and remember all those people that are at home so proud of you and looking up to you.
Remember always, medicine is a real privilege. It's a privilege to be a doctor, it's a privilege to be at a patient's bedside, looking after people at their most vulnerable, when they're feeling their worst, and you have earned the right to do this.
Medicine is a lifelong career and there will be ups and downs along the way, and a particular disappointment shouldn't be seen as a major roadblock. It's just a little bump in the road to your eventual destination.
And one day, you too will be the confident doctor that other students look up to.
Are you okay?
Good luck and stress less in medicine.